comfortable, which will then reduce anxiety and can improve through that mechanism some of the signs we see associated with canine cognitive dysfunction. So it may not be specifically addressing the deposition of the beta amyloid sheets, but it is helping with some of the kind of sequela or the secondary signs that we see. Next, we're going to talk about different supplements. And for the sake of time, I'm going to basically name the supplement, say what it does. And if you're interested in learning more specifically how those supplements work, just let me know, and I'm happy to do a second podcast about it. But not everybody wants all the nitty-gritty, so we'll just give the highlights. Phosphatidylserine is the first one we're going to talk about. It's been shown to improve brain function, and it may actually also improve memory, learning, and social behavior. SAMe is an awesome antioxidant, and it has been used for years in Europe as a mood stabilizer, and they're starting to use it in the United States more as a mood stabilizer in people. But I've also myself personally used it in dogs that have anxiety or kind of like social phobias, if you will. And in particular, I've had pretty good success when people have the birth of their first child. They've had the dog first. The dog's now very anxious about the whole situation, so SAMe can be very helpful. SAMe is also a very strong liver supplement, and it helps with liver function and health. Apoaquarin, which I'm pretty sure I'm saying wrong, aids in learning and attention tasks. And it's actually one of the primary ingredients in a supplement called Nutrix. And Nutrix has been shown to improve memory and attention and has been studied to be as effective as selegiline or anapril that we talked about earlier. Alpha-casozapine, it reduces anxiety and aggression. Melatonin, which I'm sure a lot of you have heard of, we use it a lot in people to help with sleep, and we can use it for the same reason in animals. So it can reduce anxiety, it can encourage sleep, especially if you give it before bedtime. Valerian root, which I like to refer to as natural Valium, has been shown to reduce anxiety and encourage sleep as well if it's given before bedtime. Pheromone therapy. So in dogs, we use what's called DAP, or dog appeasing pheromone. The other company that produces something very similar is called Adaptil. And this is actually the pheromone produced around the mammary glands by lactating dogs. And what they found is that pheromone reduces anxiety, makes dogs kind of feel more apart and more included. And so they made a synthetic version, put it in a bottle, and you can get it as a collar, a plug-in, or a spray. And that can sometimes really help calm dogs and make them not feel as restless or anxious. SeniLife is a combination product that is used for dogs to help reduce inflammation and improve brain function. The primary ingredients include phosphatidylserine, membrane phospholipid, which they consider a stabilizer, ginkgo biloba, which, if you're familiar with that for people, has been used for memory, vitamin E, which is an antioxidant, vitamin B6, which is good for brain health, and resveratrol. Resveratrol is actually the ingredient in red wine that they say is a great antioxidant and helps with anti-aging and memory and all sorts of excellent things. So since we don't ever recommend you give your dog wine, we can use resveratrol. Activate is another combination product that is specifically for dogs that's aimed at reducing inflammation in the brain as well as improving brain function. And its primary ingredients include, again, phosphatidylserine, omega-3 fatty acids, vitamin E, vitamin C, L-carnitine, alpha-lipoic acid, coenzyme Q, and selenium. The last category are holistic or integrative therapies, and those include acupuncture, which can be used to reduce pain, anxiety. It can also be used to improve nervous system function. Acupressure, which is similar to acupuncture, except you use digital pressure, so you push on specific acupuncture points. And that can be something that's taught to clients to do at home to help calm pets and to reduce anxiety and to aid in sleeping. Tui Na is Chinese manipulative therapy or Chinese massage, and it can be used in the office in conjunction with acupuncture, and veterinarians who are trained in Tui Na can also instruct clients how to do certain moves at home to help reduce anxiety and improve sleep. Chiropractic adjustments can help reduce pain. They can also stimulate nervous system function. Chinese herbal therapies can be used to reduce common signs seen with canine cognitive dysfunction. It can sometimes help with memory, with anxiety, with sleep, with inappropriate urination. Chinese food therapy is another modality we can use to improve immune system, increase antioxidants, and in some ways reduce anxiety. And that goes back to the idea of dietary modification. Ozone therapy is another modality we can use to reduce oxidative damage and free radical damage within the brain. Cold laser therapy can be used to reduce pain. You can also diffuse lavender, which can have an anti-anxiety effect. And Reiki, which, if you're not familiar with Reiki, in my personal opinion, can be thought of as a shared meditation. So Reiki is using energy to elicit an effect, and in this case it can help reduce anxiety. So that is kind of a quote-unquote brief outline of different modalities and therapies we can utilize to help, again, delay progression. And unfortunately, canine cognitive dysfunction is a really frustrating and potentially devastating condition for your pet, and there are a lot of options to help manage it and improve quality of life. But we just need to keep in mind that the goal is good quality of life for as long as possible, but there is unfortunately at this time no cure. And cats can also get cognitive dysfunction. We do not call it, obviously, canine cognitive dysfunction in that case. And the most common signs of cats with cognitive dysfunction are vocalization and inappropriate urination. And in cats, there are multiple diseases that can mimic cognitive dysfunction, such as hyperthyroidism, so excessive thyroid hormone secretion can cause vocalization, especially at night, as well as inappropriate urination. Kidney disease can cause that. Bladder disorders, liver disease, heart disease, trouble defecating or constipation can also cause it. So an appropriate workup with your veterinarian and a good discussion with your veterinarian about what's going on with your cat is really what's needed. And a lot of these therapies can be used in cats as well, not so much the medications and some of the combination supplements, but a lot of the individual therapies can be used. And your veterinarian is an excellent source of information and guidance for treatment. Monitoring your dog for the common signs associated with canine cognitive dysfunction is crucial for early detection. And the earlier the disease is diagnosed, the earlier treatment can be started, and the bigger impact you can have on the disease progression. So if you have concerns, if you have questions, talk to your veterinarian. You can also look up online some of those questionnaires and fill that out and bring it to the appointment and say, look, I'm worried my dog has cognitive dysfunction. I found this questionnaire online. I've completed it. Please tell me what you think based on this. But just keep in mind, your veterinarian may still recommend additional testing because while it may quack like a duck and walk like a duck, we got to make sure it's a duck, and we don't ignore that it could be, a rhino in duck clothing. So as a veterinarian, our job is to be an advocate for your pet. And we don't want to get blinders on and not look at your pet as an individual and cover all our bases. So just be patient with us because while yes, your pet may have canine cognitive dysfunction, it is our duty to ensure that there is not another disease process that's mimicking canine cognitive dysfunction. Our goal is to help your pet, and in order to do that, we have to make sure we're treating the right disease. I think that about wraps it up. As always, thank you for listening to this installment of Vetsplaining. I hope you enjoyed your time with me and ideally learned at least one new thing for the day. If you have any questions or suggestions for future topics, feel free to leave a comment below or email info@independenthillvet.com and put podcast topic or podcast comment in the subject line. Until next time.